Hi, my name is Mallory Stegmiller, and today I'm going to talk to you about HIPAA procedures and protocols. So you might be wondering, what is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act. HIPAA has two components: the portability, which is the goal is to protect health insurance coverage for workers and their families when they change or lose their jobs, and the accountability component, which the goal is to protect health data, integrity, confidentiality, and availability. So why is HIPAA important? The greatest benefit is for the patient. It ensures healthcare providers, health plans, healthcare clearinghouses, and business associates of HIPAA are implementing multiple safeguards to protect sensitive personal and health information. HIPAA establishes rules that require healthcare organizations to control who has access to health data. It restricts who can view health information and who that information can be shared with. So is HIPAA pertinent to speech-language pathologists? And the answer to that question is yes. Any health information, personal history information needs to be secured. That includes prognosis statements, treatment plans, any evaluation or data, and payments must be protected. So what information is considered confidential? Any identifying information about clients should be considered confidential. This includes clients' names, social security numbers, street addresses, email addresses, telephone numbers, date of birth, place of work or place of school, family members, and any other unique identifying characteristics. So what are the do's and don'ts of HIPAA procedures and protocols? What violates HIPAA and what doesn't? So there are many ways we ensure that clinicians are abiding by HIPAA protocols at SAU. This includes keeping client files very guarded. No client files should be left unattended in student workrooms, computer labs, or at clinician homes. No other person besides the clinician should type any reports involving clients. When client files are checked out, the client's name on the file should be facing the table so that it is not in the plain view of others in the building. All documentation of clinical information should be done at the CCSD building on St. Ambrose University computers with the use of an IronKey flash drive. So some of these documentation includes creating session plans, treatment plans, and evaluation reports, revisions of any clinical documentation, and any assignments for classes regarding clients. And all clinical related documents should be saved to the IronKey flash drive only, not to personal computers or St. Ambrose computers. Lastly, the confidentiality should also be maintained in conversations. Clinicians are not to discuss clients by name with anyone, including parents, friends, secretaries, or teachers. Any discussion about one's client should only be between themselves and their clinical supervisor or the clinical director. This also includes other electronic means of conversation, such as text messages, Facebook, Twitter, etc. So you might be wondering, can I send emails to or about my patients, or is that a HIPAA violation? So HIPAA regulations do not permit email communication between provider and patient or provider and provider. Information contained in email should be kept to the minimum necessary, and a risk analysis should be done to determine the privacy risks and address them. This includes emails that contain personal history information or any information about what clients are doing in therapy or what you plan on doing in therapy to someone of authority like. So what should you do if someone asks about your client? If you are asked about any questions about your client from someone who is not your clinical supervisor or the clinical director or other MSLP students when at the CCSD building, you should simply inform the person that you are professionally liable and that information is confidential. So my suggestion to the future is that as SLPs in the future, different settings may have different privacy policies to abide by. If you are ever questioning if what you're doing could violate HIPAA, wait and seek guidance from your supervisor who has his or her seat.